And we're live.
Hey guys, it's Dr. Emer and we're in West Hollywood, and you know what today is?
Filler Friday.
Filler Friday. Hi, Novique Medical Aesthetics. We are here in West Hollywood, and they have my new partners getting their full glam on today in West Hollywood because we're introducing our Without a Trace lift. And do you know what that is, guys? What's the Without a Trace lift? This is where you leave the office looking like nothing was ever done, because it's without a trace. We do fillers, Botox, lasers, and threads in combination to give the ultimate result. Beautiful look, natural and subtle. And so my partners are here today. Beautiful women are here today, which is great, to get this amazing treatment done so that they can do that as well, not just in West Hollywood, but on the East Coast. So here we're gonna look at her face. And again, women, when they start to get, past that 30-year-old age and they have kids, hormones start to change, the skin gets looser and but she has an amazing jawline already, and there's just subtle areas that I want to get her to give lifting. I want to create some contour, I want to fill out the temple, define her jawline, and take a look, guys, on the neck. What do we see? The dreaded tech neck. Tech neck. That happens from, what? No. That happens from texting all the time and looking down. So we're going to fill this with a little Bellatero just to make it look better. So we're going to do all subtle lifting. Let's start in the temple. And we're going to use Radius down deep. Now, when you're a little thinner, the needle might not go all the way. So we're just do a subtle bit. She doesn't need a lot, actually. So we're going to do a little in the superficial area up high. And then we're going to come out. We're going to go down a little bit lower, go all the way to the deep area. It feels weird. It feels like someone's crunching on the bone, but that's because we're in a really safe area that almost no bleeding. Take a look. Skip it over.
Did you hear it?
I heard a little bit and it felt full. That was kind of the feeling you feel.
Heaviness,
Gotcha.
fullness, pressure. All right, now let's go to the other side. Let's go to the other side and let's do a little bit more. Now you have to watch out for that little vein. Be careful of those veins. We're going to go around the vein and go into that deeper temple.
Your eyelashes are beautiful.
Thank you. I use Revitalash. We sell it too.
Mark Revitalash, I know the owner of the company. When I was a resident, we almost did a study using Revitalash on the hair, but instead I used Latisse and proved that it grew women with female pattern hair loss, and it was published in the Journal of Dermatologic Surgery. It's one of the first articles ever on hair loss in women using Latisse. So now the temples are revitalized, not revitalashed. And we're gonna lift. We're gonna just lift. Let's get a little lateral contour. Let's focus on giving her some definition. And the thing is, she already has a nice size. We don't want to increase the size too much. We just want contouring. This is where women put their makeup on. They look hotter. They look better. So we're lifting, okay? Now with her apple of the cheek, her jawline, her cheekbone is a little high here. So we're gonna go in and blend that to her middle face, mid-face, right there. And also the submalar area, because this will blend it properly.
And what filler are you using?
This is Voluma, because it's going to last a longer period of time. I'm blending now her outer eye. Beautiful. So now, let's hold a little pressure there lightly. You're fine. And we're going to switch to the opposite side. We're going to do that same thing. We're going to turn her head. We're going to notice that this is starting to come down a little bit. We want some contour. So we're going to lift all of that by going to the apple.
Someone wants to know, what are you trying to achieve doing this?
So we just said that I wanted to lift and contour the cheekbone. So that's what we're doing. We're using fillers to give her subtle lifting.
What else can we use to get a subtle lift?
Subtle lifting, we can do skin tightening, like Morpheus treatment. We can do Insta-Lift threads, or you could do a facelift. But what are we doing today, guys? What is it called?
Filler Friday.
No, that's today. What's the treatment? The without a trace lift. She doesn't want a facelift. She wants to do this without a trace. So we are doing this without a trace. Except for maybe a little bit of bruising and swelling, but that's it. So we're lifting, lifting, lifting. We're moving back laterally on the bone. And giving her some contour. And then as we age a little bit, there's a little bit of volume loss in the lateral part of the eye. So we're just doing little tweaks right around there. Now, the subtle bit I have here, I want to just give her that little chisel. So I like to follow the natural shape of this person's jaw. Some people lately are creating sort of squared off looks for most women. I don't find that it's that attractive.
Dr. Emer, do osteoporosis drugs prevent facial bone loss?
That's a good question, actually. Some of the studies should say yes and some say no. But in general, it's long bones, not short bones. So osteoporosis drugs would work on your central and lateral bones, and not your facial bones. Okay? Woo! That's good. Just a little more. Okay, so now we're gonna do that same thing over here on the jawline. I'm gonna build that out subtly. Can you hold up here on the top? There you go. And again, that 90-degree angle, just a small bit. Just doing amazing. Now what we're gonna do is utilize some of the filler I have for the jaw and let's shape her chin. So everything looks great in that central face. We now want to give her enhancement and bring this forward a little bit.
Can you do a brow lift with Botox?
You can, but we're doing fillers right now. So what we're doing right now is shaping the chin, get a nice contour.
What happens when a patient wants filler removed?
We reverse it. Depends on which filler though. Some fillers can't be reversed, guys. Some can. So we're now shaping and want to keep her chiseled. We don't want to make her too wide. So you see, I'm going to show you guys what we just did.
Are fillers a good option for people with thin skin?
Yeah, it can be, sure. So you see here now we've lifted, we've given her a little definition in the jawline, brought the chin forward. Now we're going to work on her folds. And we're going to do very subtle, very soft filler. You guys know this is one of my favorite velour. This is a mixture of a soft and a harder filler so we can get some shaping while also, turn a little this way, also getting some softness. So we want to build out the jaw just a little bit. We're going to do a Q-tip technique in a second. We're working on the marionette as well.
Can you do a nose lift with fillers?
You can. And I've been on the doctor's show twice showing that. It's on my YouTube. Come over here. Switch with me.
And what do you recommend for patients after fillers?
What do you mean?
Like, what do you recommend? Like, what
for
kind of care
bruising,
should
for
they?
swelling,
Mm-hmm.
nothing. Enjoy yourself. You do ice packs if you want. A little vitamin C if needed. But do you see how now we're defining the jawline? We're making the marionettes much less. I gotta move towards you. Should stay in the front. Stay in the front. Okay, and then one area that we typically like to make sure is defined is right at that 90-degree angle. So let's make it pop a little bit.
And this is Juvederm?
This is velour.
This is velour.
Juvederm velour, one of my faves.
If you guys want to see more content, go to his YouTube channel. It's Jason Emer, MD.
Okay. So let's keep it going. Wait, hold on, let me just a little bit. Turn that way. Good. Really like this 90-degree. Great. Okay, so we're gonna clean her for a second. We're gonna work around the mouth now. Now, the key, oh, this looks so good.
Dr. Emer, why Juvederm velour?
Why not? I love it. It's very soft, it's natural. And now for her lips, she's got little baby lips, so we want to make sure we keep them nice and cute. Her lips are a little longer, which is okay, so we're going to kind of move our way all the way down very subtly. You can see already, take a look what it looks like when you do a little plumping at the border. Okay, the key here is to give her some shaping. So let's define filtral column.
To stop the bleeding, we just use like that little napkin with alcohol, correct?
The gauze, yes.
Gauze.
Yeah, napkins are for food. Gauze is for patients. So now we're just going to do a small bit, and we're going to keep it very medial. Beautiful. We're going to do a little bit into the wrinkle of the chin, just to soften everything. And now we're going to switch sides. You guys can see already one side being much more improved than the other. Same thing here, very little. Almost there. Did that same thing, create shaping. So look great. Look swollen today. You'll thank me tomorrow.
Can fillers or Botox be used
Moisturizer
for
with
eye
Botox.
lift?
Yes, it's all on my YouTube. That is all on my YouTube. Close your eyes. Everybody always tears.
Yeah, I'm not crying, just tearing.
No está llorando.
Any bruising typically needs pressure and it stops it. One of the things I want to do for her is blend her under eye area, so we're just going to do a very small amount of really high up on the eye. Which really shouldn't feel much there. You see what we've already done with the jawline, you see now what we've done with the lips. And now we're going to go to the eye laterally. Okay, let me take a look at the front. Give her a little definition at the edge of her lip.
And what is this filler?
This is Volbella. It's really soft and subtle. Then always good to do just a small amount in the corner. Now, did you numb your neck?
Yeah.
Okay. So face, as the face is healing, we'll start treating the tech neck. So turn your head a little bit here, this way. I want to look at those nice lines, okay? You just do little blebs. I call this a string of pearls. Okay? Very superficial. Little injections. Right into there. And then we're going to do a Q-tip technique.
How can patients avoid tech neck?
Stop typing on your computer and your iPhone or your smartphones, or come in and get Botox and filler on your neck. That'll make it look better. So now she's gonna massage that in. We're gonna move our way over. Let's continue the tech.
Did you use lidocaine?
Yep, she's topically numbed, and there's also numbing inside. We're just gonna follow these lines, the little baby bits.
And can you use any type of filler for tech neck?
No, this is a superficial filler. I personally like using this. I know other doctors use thicker fillers here. I think there's a tendency to clump and lump. I think long term the nicest thing is to do soft, fine wrinkle improvement, and that's using Bellatero, which is one of the more superficial fillers. Should bring your neck down a little bit. There you go. Follow some of these folds.
Le está aplicando rellenos en el cuello para que se le quiten esas arrugas.
You tell him, girl. Me
Yeah.
too. We're diverse.
And she did get lidocaine on her face and neck.
Yep, she's numb. Look at, she's not even feeling it, guys. She's amazing.
What about Volbella
You
to
can.
treat tech neck?
It'll be more expensive. So this is a nice, cheaper option and gives amazing instant results because it's the only filler that blends right into the superficial part of the skin. So within a few minutes with our Q-tip technique, you will see this blend. So now, hold on. Good, making sure everything's even. We're gonna do the Emer reveal in a second. Much more blended, you guys. You can see less folds in marionette area. When you pinched, it's not droopy. We're bringing out that chin, lifting the cheek, defining the jawline, lifting the temple and brow. All right, let's show her. Do the Emer reveal.
You ready?
I am.
Can't pull that one down, guys. Can't pull that down.
Here you go.
So take a look, guys. So we just did feet. Look up. You gotta look up. Bring this up. Up. You always gotta look at yourself from above. Chin up. There we go. So now we're showing definition in the jawline, lifting in the lateral cheek, softening of the under eye folds, softening of the nasolabial folds. Look at your lips.
I love my
Much
lips.
more
Wow.
contoured. Softening of the temple. And when you smile, nothing looks overdone. It just looks lifted, it looks shaped, chin is projected, fine lines are improved. This is the without a trace look, guys. This is using filler to lift the face. Next, we're gonna do Botox to give definition. It's gonna look amazing. Let me see again.
I
Take a
can't
look.
wait.
Wow. Guys,
Look at that
it looks
jaw.
like it's your birthday and it's not.
I know it's Irina's birthday.
So
not
show
mine.
your neck really quickly. Look up for, no, look straight again. Go look up. Now hold this down a little. Show them the necklines. Go closer. There you go. See those little lines all there? All have been injected. You can see how much more improvement there is there. Take a look. We're going down. How much more improvement there is there. In the next few weeks, that's going to all soften. Look up just a little bit. All is going to soften. She's barely going to see those.
And I could continue using my phone.
Yep. So lift up, and now what I want to do is we're going to flip that back. Go ahead and give it a mirror. Let's show her how she looks in the mirror. Stand up straight, always up from above, chin up. Take a look at your jawline, nice and slow. What do you think?
I love it.
So this is lifting and contouring, defining the jawline, softening here, which we're gonna Q-tip a little more, definition in temple, and softening all throughout.
So
It's gonna do
natural,
great. So it all looks subtle, it looks natural, beautiful lips. So guys, we're gonna go on to step 2 without a trace, doing our Botox in 1 second. Stay tuned.
And if you guys want to get this treatment done, send us a DM with your name, your phone number, and your email.